I'm a Canadian-trained physician. I'm Canadian-born as well. I worked in universal health care. I know universal health care. I'm not here to say that I need a pay raise. I'm not here to say that physicians are at risk of leaving the state in droves. That said, I will tell you physicians do not like uncertainty. This bill speaks largely to uncertainty. As a tenured faculty at the University of Vermont, as well as the chief of urology, I can tell you that it is very hard to recruit to the state of Vermont, and most of the most of the kids, I'm getting that old, most of the kids I train are walking out of school with debts in excess of $200,000. That's not a system that they designed, it's a system they inherit. I can also tell you that in terms of access to care, we unfortunately do have wait times that are as a result, unfortunately, of decreased efficiency of physicians. Increased regulation as well as onerous systems, which include learning EMRs, have not helped us in our goal to increase patient care.
So not only am I a practicing gynecologist, but I'm a small business owner, and so I'm looking at this situation from both perspectives. I'm also married to a gynecologic oncologist who's a subspecialist in this state, one of 3 GYN oncologists in this state. When we graduated from medical school and completed our training, we had $500,000 in debt between us. I opened up my new practice and took on a series of more debts. I would not say I'm for or against a single payer system. What I'm in favor of is careful, thoughtful planning before we take on something which could potentially hurt our ability to practice medicine in this state. I did not live in Vermont and choose to live in Vermont because I want to become a multimillionaire. I knew in practicing here that I was never going to make as much money as I could make out of state, and certainly my husband could be making 5 times as much money in another location. We're not here to make money. But when I look at the open door on what my reimbursements are going to look like, what my payroll tax is going to look like, administrative costs, which are supposedly going to be lowered, but I only have one billing administrator in my office. I'm not going to fire her, so I don't see how I'm going to actually save any money from an administrative standpoint. It's really difficult for me to see how this is actually going to work. So rather than being for or against, I feel like I need more information. And the one thing that my big take-home message is, I don't want to leave Vermont. We would really like to stay here. This is a good place for us to be. But I think it is very quick to move if you're moving legislation through without healthcare providers being on board.
We're told that primary care is the backbone in medicine, yet all the reforms to date have only served to make the current plight of primary care even worse. To back up this claim, several years ago, Con Hogan, the former Secretary of Human Services, Terry Dorn, former journalist, and myself did a survey of Vermont's primary care physicians to measure the level of dissatisfaction. I have a summary of it here. And this was a dissatisfaction with the conditions of practice. We mailed 840 physicians, primary care physicians, listed as having an active license with the Secretary of State and had a 36% response rate. I have a summary of that, which I won't go over, but I will say the results were unequivocal, that the level of dissatisfaction is disturbingly high. These doctors are tired of the mountains of paperwork, administrative hassles, and bureaucratic intrusion into the exam room that the current system gives them, and they want relief. And this widespread dissatisfaction is an aspect of Vermont's healthcare system that has not been given adequate attention. In fact, it has been all but neglected. Past studies have focused on shortages, but not the dissatisfaction with the conditions of practice. So I realize you're getting tremendous pressure to slow down the process of reform, but what is clear from the results of this survey is that if you don't do something to change the conditions of practice for primary care, we will not have a sufficient primary care workforce. We need the simplicity and the guarantees that a single-payer system gives to us and our patients.
There's currently a shortage of orthopedic surgeons in the state of Vermont, and 15% of hospitals have had to resort to hiring locum tenens physicians to fill the needs in their community. This summer, one of 3 orthopedic surgeons at Copley Hospital will be leaving, and the only orthopedic surgeon at North Country Hospital in Newport is also relocating to Michigan. This is going to create a crisis for residents living in the Northeast Kingdom, as they will lose significant access to orthopedic care. 20% of the orthopedic surgeons in our state are actually planning to retire in the next 5 years, and it takes 3.5 years to hire an orthopedic surgeon to work in the state of Vermont, and some practices have had vacancies for 15 years. Members of the Vermont Orthopedic Society all agree that healthcare reform is necessary in the state of Vermont. We firmly believe that healthcare reform needs to include a reduction in administrative costs and burdens on practitioners, the needs to address the practice of defensive medicine, and needs to encourage individuals to change their lifestyles for better health. Many of us, however, had grave concerns over the governor's budget proposal to end Catamount Health, rolling those patients onto Medicaid, as well as increasing the hospital provider tax to 6% of net revenues. The end result of either of these two actions would be to further decrease our reimbursement for our services without any concomitant reduction in our overhead. Thank you.
And I just believe under a unified healthcare system that we would get better care for people with chronic illnesses. I think if we could have that, we could have what they call best practices, and that best practices in the long run would be more economical and get better care. People who have good quality health care seem to be so strongly opposed to implementing good quality health care for everybody else. It seems like they all agree that we need to make a different system. They just don't want to do it now. I think now is the time to make a first step forward to doing that.
It has been my experience that the big elephant in a room has always been the insurance companies who have dictated how and who gets the care that is needed. I have spent hours on the phone, which amounts to several non-billable hours, to get authorization for medications where the goal of treatment, as far as the insurance companies are concerned, is not what works for the patients, but what is the cheapest or generic brand. I believe a single-payer healthcare system will remove that elephant out of the room and recognize the primacy of the patient-provider relationship.
We looked at over 9,000 patients, and my point is that we were concerned about access. We're a rural community, and this was in rural Maine, New Hampshire, and Vermont. And we found that unlike Great Britain, in Scotland, where there's actually staged migration and increased mortality in patients in rural communities that don't have access to care, we found in these 3 states that the rural communities actually provided pretty good care compared to their counterparts, i.e. the population living around Dartmouth and Portland. There were some discrepancies, and those are pointed out there. So my point is, with the uncertainties that Dr. Plant had noted, with no adequate, with the funding mechanism still up in the air, paying attention to the details is really, really critical. And the whole reason I undertook that study, which was an incredible amount of work, the whole reason I took that was I thought that the rural oncologist, and oncologists are rare in these 3 areas. I mean, if you look at Rutland, we didn't have an oncologist for several years. Second largest city in the state, which is just crazy. Anyway, so my point is, don't throw out the baby with the bathwater. Thank you.
For these 30 years, I've seen the sacrifices made by family physicians and other primary care providers in this state. These are the personal and economic sacrifices that allow Vermont to even consider the reform we are debating. When contemplating this reform, do not forget these sacrifices family physicians have already made. The Vermont Academy of Family Physicians supports your courageous effort to reform the healthcare system and move towards full implementation of Green Mountain Care. We believe this will allow the development of a foundation of primary care providers who are well supported throughout the state. If this is not built, nothing else matters. Reform will fail. I've heard reference to physicians leaving Vermont because of this healthcare reform. I'm not surprised about this response because a colleague recently reminded me that we have all become psychologically dependent on fee-for-service healthcare. In other words, primary care specialists, administrators, and insurance are all addicted to fee-for-service. In our hearts, we know that this is not sustainable, and sometimes it even causes harm to our patients when the incentives are there for us to do too much. I have treated many patients with addiction in my 30 years. The way you treat an addiction is by doing an intervention, which you are doing, and then prescribing a recovery program. Family physicians are ready to recover from this dependency. Those who continue to be in denial about their addiction will relapse, and they will find other places to work the fee-for-service system. Those of us who do recover will flourish in a system that makes everyone as accountable as family physicians have been for generations in Vermont. My greatest concern is the current decline in family medicine primary care workforce. For an entire generation, 25 years, 90% of graduating medical students have chosen careers other than family medicine. This year, only 5 students graduating from the University of Vermont chose family medicine careers, and that is the only career training that will guarantee a primary care physician. Thank you.
The bottom line here is we as specialists who have gone through anywhere between 6 to 8 to 10 years of advanced training, who desperately are trying to serve the public here in Vermont, provide excellent urologic care, we feel extremely threatened by this legislation in many respects. We think it will greatly impair our ability to provide the highest quality care. More threatening is the fact that many of us are over the age of 50, thankfully not including myself, meaning that they are approaching the nearing retirement. It is very difficult to recruit urologists to the state as it is. Threats to reimbursement, capitation on what doctors can do, rationing of care, and then urologists leaving the state and retiring and not being replaced by new doctors who are very hard to get because they get very lucrative offers from other states will make urologic care in this state impossible.
I believe in universal access to health care, but I have lots of questions for you, so I'm going to be the teacher sitting at this table tonight. Will you consider how to unburden primary care providers from prior authorizations for imaging and medications? If we are a proven quality practice, why should I be spending, as yesterday, an hour and 20 minutes doing prior authorizations? I'm a very expensive clerk.
And you may be surprised to know that I don't believe we should leave the current system alone. I also don't believe that a single Vermont resident should be without access to care. I do want you to know, however, that we have been working on many of the important issues that we've already raised. We've been working on primary care medical homes, we've been working on the implementation of electronic medical records, and the pursuit of quality medicine. We've done all of this despite the fact that we have never been paid for the true cost of our services by the Medicaid program. We are paid about 50% of our true costs by Medicaid. Furthermore, next year's proposed budget will negatively impact us by about another $400,000. This historic underpayment has resulted in the cost shift that has made insured patients rail against the system and the costs. In response to these concerns and in response to the cuts that we've felt over the years, we have focused on our costs. Unfortunately, now we've had to focus on labor costs. This past Monday, we laid off 15 FTEs, which are 24 people who live in my community, people who worked with us every day. This was a difficult decision and not one that we took lightly. However, we did it because we wanted to provide value to our patients and we need to meet the underfunding requirements that we are currently under.